And that's a taxpayer dollar. That is the money that belongs to the taxpayer dollar, and that is a big figure. And if there is fraud, if there is waste, if there is mismanagement, then we need to make sure we take care of it, but we're also taking care of the client at the same time and not leaving them without the services while the Attorney General decides what to do next.
The companies say that this is unfair because they have not been able to see the charges that they're possibly facing.
Well, certainly the Attorney General, because we've turned it over to the Attorney General, we don't want to jeopardize an investigation in any way. We don't want any kind of documentation to be lacking when the Attorney General does his job in searching for records to actually back up the allegations. And so we'll leave it to the Attorney General to share whatever he thinks is appropriate, because he will know best what would or would not jeopardize an investigation.
And for someone who's a patient in behavioral health services, some of them are very concerned that they're going to be shut down this week.
We have services that are being brought into the state to take care of those individuals. We're not going to leave people without services. We have a company that is coming in to New Mexico to pick up the patients to make sure that they're not without services.
Why were all the companies from Arizona? Is that just proximity to this state, or?
They've done this before. They have been able to pick up services when there have been problems in other states, where there have been other allegations of fraud or misuse or mismanagement, and so they understand what needs to take place in order to pick up the patient care, and so they have that history, and certainly the proximity is a benefit, and we want to make sure that those patients have quick access.